welcome to the first ever International Healthcare Social Media Summit, or IHSMS as we branded it here. I'm John Seng, Chair of Global Health PR. Global Health PR is the largest health-focused public relations firm comprised of independent public relations agencies worldwide. We represent clients in the most important markets throughout the world, from Asia, South America, North America, and throughout virtually all of Europe. And we also offer representation in the Middle East and Africa as well too. The members of Global Health PR help a broad range of clients achieve their business and organization goals through targeted and strategic communications that rely heavily on social media. All the tools and tricks of the trade are represented by what we believe are best in class sitting right here at the table throughout our partnership. Now, over the past year, we've seen with world events a great deal of social change and upheaval, particularly in the Middle East. And when 30 years ago, Hosni Mubarak took power in Egypt, no one could have predicted that in a matter of 18 days, 30 years later, that really this whole cascade of angry tweets would help to contribute in large part to bringing down this leader. So we thought, when it comes to global health and global health issues, what if the power of social media could be brought to bear on behalf of a global scale pandemic? And the pandemic that we have in mind and that we're studying and reporting on here to you today is none other than malaria. Now, malaria is a crucial, critical, killing disease that kills one child every 45 seconds. So we thought that this would make an entirely appropriate case history. So with malaria as rampant as it is, the partners of Global Health PR undertook this study of global health, this global health crisis, to understand what the conversation is around happening around on a global and as well as local scale. Why are some people, some social media participants in some countries more active than others in other countries, and what would be the learning lessons from a health communication standpoint that we could apply based on our learnings and our study in the malaria case history. So what we'll cover over the next 90 minutes includes the tipping point for health and social media, what our social framework for engaging social media programs looks like, our insights into social media and malaria, and then Global Health PR's prescription for malaria social media engagement. Then we'll have plenty of time for your questions. Our Q&A is going to be managed by my colleague Neil Crump from the United Kingdom, Global Health PR, who will also be monitoring during the Q&A period. Also joining us up at the panel table here are Paula de la Barreda from Global Health PR Mexico, and our friend Aaron Pond with Global Health PR in the UK, and then my colleague Anthony LaFauce from here in the US, Global Health PR. Both Aaron and Anthony are directors of digital and social media strategy, so they're more than well qualified to lead us in this discussion. So now I'll turn it over to Anthony to set the stage for our listening approach in the social media study on malaria. Thank you.
Hello everyone. As John mentioned, we're going to talk about what we consider to be the tipping point and why healthcare really needs to focus on getting into social media and new media with a greater vigilance than it's been doing before. And what we're really going to cover are three main points that we see as the tipping points. The first one being technology, and we'll talk about why the technology has changed and what is really allowing us to be more active in this space. The next area that we'll talk about is this new health dynamic, some information on the way people use the internet, which has changed slightly over the past few years. And then finally, the regulations on why it's important to get into the space now more than ever. So the first bullet point that we'll look at is technology. And what you see with this graph is several different axes. The first one being data transferability and usability. Now, with data transferability, what you can think of is this. 10 to 15 years ago, you were getting online with maybe a 9.6K baud modem, 56K if you were lucky, 14, 4K, very low data transfer. And that really inhibited the way people could use the web. If you thought about how long it took to bring up a web portal, because at the time you didn't have Google search or Yahoo search, you logged into a web portal, which you could then click through other links to sort of find where you were going, and how long that took compared to what many of you do today with your cell phone on sort of 3G and 4G networks, with some of the newer networks getting 20 megs a second over the air, that you can quickly cycle through websites. The x-axis is usability, and this really has a lot to do with time and evolution of the web. So as the web got older and older, people learned how to design better for it. Sites became streamlined, web pages became more interactive. It wasn't just putting information up online. People actually thought about what they should put up online and how it should be put there, and the user was really brought into the experience. And what we find is those two elements really combined to increase engagement. So the combination of faster internet and more reliable, usable internet really meant people were getting online more for everyday activities. So, 5-10 years ago, when you went online for, say, college research or school research, I mean, that was a big endeavor because it took a long time, versus now where you go online to check a movie time or the weather or lotto scores, just because it's that much easier. The next slide is sort of the new health dynamic, and this is an interesting concept that I like to liken to the concept of banking. When you think about the way people approached banking 4 or 5 years ago on the web, they were very scared to put information out. Putting your account number online was a crazy concept. No one wanted to do it. They were very afraid that that information would get lost somewhere. But over the years, we've kind of grown accustomed to it. I went into a bank 2 months ago and didn't know how to interact with any of the tellers, just because I go online all the time. I was very confused on what to do. Like, I hadn't been in a bank in forever. So that mindset has completely evolved, and what we're finding is that mindset is starting to transfer over into healthcare as well. So people are starting to look more and more into putting information out on the web and using it. And the stats you see in front of you, I think, are very telling. The first one is that in the next few years, India is forecasted to have 45 million social media users. Now, India has more English speakers than the rest of the world combined. It is an amazing market with incredible dynamics. Every day, 45,000 people join a social network. That is astounding. 45,000 new people delving into social media, crawling through information. Then the next numbers you see underneath are Mexico. And Mexico has 30 million internet users, and the fact that blew my mind when I read it was 1 out of 10 internet users in Mexico have a blog. 1 out of 10, that is an astronomical number. That means people are getting on the web not for just casual purposes, they're putting information out there and they're creating content, which is astounding to me. So the next slide we see is for Portugal, and 28% of people online in Portugal are searching health information. So, nearly over a quarter of the people who are going online are looking for specific health-focused information. They're not doing casual searches. These are in-depth searches where they're looking for very particular pieces of information. And since 2005, that number's almost doubled. So, 4 years ago, 6 years ago, the numbers were very, very small. There weren't a lot of people doing these types of searches. So now more and more people are doing that, and the information is really being pushed out there. Below that, we see that 18% of national hospitals provide patients internet use. So that's that moment of inception, when you're in the hospital, when you're worried about something, or when you have a question with your doctor, you have the internet there. So you're using it as a resource or a tool, again, not something as casual. Below that, we see that we looked at some patient groups online, and of those patient groups, the 9 of them, 100% of them had Facebook groups, Facebook pages. So they were putting information on a social network. They have other pages as well, blogs and forums and chats and other things that they're using, but they're using a social media platform as one of their main communication points to the general public. The next slide here, we have the American view and how we use the internet looking for information. And 59% of Americans look for health information online. So over half of the people who are going online are looking for health information. That's an astounding number. The next number below that is 25% of those people are seeking it through social media. So they're not going to what we would consider a medical source. They're going to, comment pages or forums or blogs or something outside of the traditional media focus or the traditional healthcare focus. So they're looking for other sources of information. And what this really has to do with is that people are creating new information sources and new experts. So if you begin regularly talking about a health issue or a health concern, you're becoming an expert in that area. And then finally, 23% of all of those people are really engaging just on social media for healthcare information. So instead of going to a doctor and asking the doc, what do these symptoms relate to, they'll ask a friend first. And the fact that they're doing that online with social media means they're comfortable putting that information out. I have rash, I bumped up against something, I'm concerned with a health issue, and they see that conversation as normal as having a telephone conversation with someone. So that's the level of engagement people are starting to use. So in the UK, the number of users who are looking for health matters online has almost doubled in the past few years. So more again, just we see in the US, more and more people are going online. They're not taking the traditional source or the traditional phone call. They'll take that first step looking for information online. Now, the telling fact that I like underneath this is that 22% of those people were looking for information for somebody else. So a friend has approached them and the friend was concerned about something, or a family member was concerned about something, and they're going to their own friends as experts. Well, what did you see online, or did you read this somewhere? And they're pushing that information to other people through email, through other chatters, through face-to-face interaction. So they're beginning to create their own personalized communities around healthcare information. And underneath that, we see healthunlock.com, which is a pretty interesting concept. These are kit or prefabricated social networks, basically, focused on healthcare issues. So you see the stat underneath that talks about rheumatoid arthritis. And in a 3-month period, a group that we would consider less than apt to go online to create a community, because they're still slightly older than the average user, in 3 months, 300 people have joined this community, and they're actively blogging, they're engaging in surveys, so they're interacting in these prefabricated networks of really dedicated communications around a certain illness or disease. And that's an amazing trend, because if that keeps propagating, we'll see these niche communities develop that will become incredibly rich content centers for anyone who finds that information online. Now, the final point of sort of why we should do this now is the regulations. Now, here in the US, the regulations aren't as strict or as strong as we would like. Currently, the FDA has been out for about 6 months saying that they'll get us regulations on social media interaction. So we're still waiting for that. But in the last month, they have reevaluated the processes that they look at websites. So they're really taking another look at this concept of unbranded and branded websites and taking a user focus. So instead of the FDA coming out and simply saying, these are our regulations, they're actually focus testing a lot of this information with users to see how they see a website and then putting that into their future mandates. With ABPI, we sort of have a loose guideline right now. They've come out and given us informal guidance on how to do this in the UK, on what we can say and what we can do. It's not solid yet, it's not written in stone, but it's the push in the right direction. So the UK is being much more progressive right now than the United States. And in every other country, these messages are starting to trickle through, and we're all seeing that move forward. And what it all has to come down to is that these agencies want to make sure that online communications and social media are transparent. It'd be very easy to create hidden messages or not disclose who you are or what you do in social media, and that could convolute any of that message that you put out. So these agencies want to make sure that information is put out properly, especially in an information versus promotion mindset. So if you're putting out information that's general, good health information, typically we're seeing that unbranded is okay with that. But when you switch over to the promoting of a product or idea or an action to go see a doctor about a certain thing, they're becoming increasingly regulated on that. Things like unable to hide information below the fold on a website, really mentioning who you are and who you represent as early as possible. So now I'll hand things over to Aaron, and we'll sort of talk about our approach and the way that we look at this global monitoring and engaging on social media online.